Typically, an embryo transfer is not painful. It's like someone experiencing a speculum exam in the GYN office, or a pap smear, or an insemination if they've already had an insemination. It's like that. We do the trial or mock transfer. It is a speculum exam. The physician, who's ever doing those, or if they have a certain request, will do their procedure for them. The embryology team member is part of it, one of the nursing staff is part of it, and then the physician. And the anesthesiologist is not present unless we're providing that monitored anesthesia care. Clients do have the option that they can receive acupuncture prior to their transfer and then post. Dr. Kiltz is very gracious in giving our clients the buy one, get one free. So that I like to tell the clients it becomes a day all about them. They come in early, they have their acupuncture treatment on a warm heated bed, very nice and relaxed. And then they can come down, we'll draw some blood work on them. At this point we may review their post instructions, or we could do that after the transfer. We get them set up for their next 2 sets of blood work, including their pregnancy test, and that's based on the day of the embryo, how many days old that embryo is. We calculate it for them and have everything written out. We're there to answer their questions. If it's a fresh transfer, they have the opportunity to speak with the physician on how many embryos to transfer. If it's a frozen embryo transfer, that number has already been decided, because the number is based on how many we would thaw prior to their retrieval on that day. Again, if they had any questions like, I'm not sure how many to do, talk with any of the staff members. They can help and assist them what our guidelines are and what our protocols are, depending on how many embryos they want to transfer. They're allowed to rest for the transfer, and partners can be in the room for transfers. I do want to stress that someone can accompany them into the room. No colognes, no perfumes, no body oils, no sprays like that can have a perfumey smell to them, because we're trying to maintain the quality of the embryos. So it's very important that they can use deodorant, but nothing else. After they rest for 15 minutes, we get all their paperwork and make sure they don't have any questions regarding what is going to take place or what has happened. And then we send them back upstairs if they're doing acupuncture for another wonderful acupuncture appointment that's on heated beds, and it's really very calming, soothing, and relaxing for the client. And that's what it's really about, so that we can decrease some of that stress related to that. And then we will see them for their next, if they're in an in-house blood work draw, we'll see them in about 4 to 7 days after that, and then again for their pregnancy test. If they're outpatient, because they've come in just for the transfer, we set up their lab requisitions in the facility that they're going to use on an outpatient basis.